What is an anxiety and how to overcome it? Anxiety disorders are the most common type of mental illness that affects adults and children. Anxiety is a natural emergency response of the body to danger. Anxiety states are manifested in different forms and intensities and can cause a wide range of symptoms, from discomfort to rapid heartbeat, tremor, sweating, and dizziness. Sometimes anxiety is an exaggerated response to a real situation, and sometimes it produces a phobia that causes avoidance of various situations perceived as threatening. Anxiety can also be attacked by the mere thought of the same state or thing that is considered frightening. There are spontaneous anxiety states that attack without warning, and there are anxiety states that are gradually built up in response to the encounter with the object of anxiety. In some situations, anxiety becomes an oppressive and extreme phenomenon that harms the quality of life. Anxiety disorders are divided into several specific diagnoses: generalized anxiety disorder (GAD), obsessive-compulsive disorder (OCD), panic disorder, post-traumatic stress disorder (PTSD), social anxiety disorder, specific phobia. What causes anxiety? Anxiety disorders may develop from different causes, and one cause can not always be identified. It is commonly thought that anxiety stems from psychological factors, such as personality, from events that occurred in life and lifestyle, and from physiological factors such as heredity and chemical processes in the brain. What are the symptoms? Anxiety also has physiological and psychological manifestations. The physiological manifestations may be accelerated heart palpitations, muscle tension, dry mouth, sweating, nausea, diarrhea or discomfort in the digestive tract, cold hands and dampness, difficulty in swallowing. The psychological manifestations of anxiety can be paralysis, irritability, detachment from the self, and even fear of madness or death. How long did it last? Through professional care, most people with an anxiety disorder can be helped. The speed with which the treatment assistant varies from person to person. Some people will respond to therapy after a few weeks, while others will need a year or more. Sometimes the treatment is complex, as people often suffer from several anxiety disorders at the same time, or in addition to anxiety they also suffer from other mental problems such as depression. How to treat? In general, there are two treatment tracks, the psychological track and the drug route. The psychological track is divided into several methods. According to the dynamic method, the anxiety stems from unconscious emotional factors that must be processed in therapy. In other words, anxiety attacks are a focused symptom that signals a deeper psychological problem, so there is no point in removing only the symptom because the real problem will remain and only substitute for form. Therefore, long-term dynamic psychological therapy is needed to reach the root of the problem and thus to solve it. The disappearance of panic attacks cognitive behavioral method can overcome anxiety attacks in short-term treatment and improve the quality of life. Regardless of the factors responsible for the attack, the body and mind can be taught methods of relaxation and increased self-control that will reduce the fear of a seizure and thus reduce the likelihood of a seizure. This approach is aided by therapeutic techniques such as relaxation, guided imagery, and hypnosis to enhance the effect of cognitive therapy. It is possible, of course, to combine both methods. The medical therapeutic approach does not necessarily presume assumptions about the causes of the phenomenon but rather assumes that for some reason or another there is some imbalance in the level of neurotransmitters in the brain, an imbalance that can be corrected by medication. In severe anxiety situations, it is advisable to use the medication in conjunction with psychological treatment. It should be emphasized that drug therapy does not put an end to the source of the problem, and therefore anxiety usually comes back after the medication is stopped. Psychological therapy is designed to bring about long-term changes in habits in order to prevent the anxiety phenomena that affect the quality of life. Will it come back? Anxiety disorders can be one-time, but can also repeat themselves. Their direction depends on the factor that stimulated them on the treatment that can be overcome. For example, if an anxiety disorder occurs in response to a one-time event that is not repeated, there is a good chance that this is a one-time response. Conversely, if anxiety disorders are not necessarily related to an external event, the recurrence of the phenomenon depends on a range of factors, both genetic and environmental. The type of treatment given also has a great effect. For example, if the treatment was based mainly on drugs, it is likely that the anxiety will recur with cessation of medication. On the other hand, if the treatment was combined and included both medication and psychological therapy, the anxiety may not recur at a high level, and even if the panic attacks return at a lower intensity. Could there be complications? Anxiety disorders impair daily functioning, and this can have serious consequences for family life, social life, and career. What are the warnings that require immediate medical attention? Anxiety disorder is not a medical emergency, but it is definitely advisable to seek medical help when a decrease in functioning begins. Without treatment, the above-mentioned complications may emerge. How do you learn to live with anxiety disorders? Anxiety can become an oppressive phenomenon that affects the quality of life. In order to deal with it, one must understand the contexts in which it appears and learn how to deal with it and how to make friends with it, to accept that in certain situations it appears naturally. All these can be achieved through psychological therapy. 8 tips to prevent anxiety attacks. 1. Manage a calm and balanced lifestyle. The first tip to treat anxiety is to try to avoid, as much as possible, the pressure that triggers an outbreak of panic attacks. Be sure to sleep well, rest, and take breaks. 2. Proper nutrition. Reduce caffeine, sugars, and fatty foods from your diet. All have been shown to be effective in reducing seizures. 3. Take a deep breath and relax your muscles. Try to prevent the attack from getting worse. If you feel an anxiety attack on the way, take deep breaths and relax your muscles by stretching and relaxing. Focus each time on a different area. Stretch your muscles for a few seconds and let go. 4. Feel your body. Stretch your arms up, touch your fingers, legs. In short, you will feel yourself. This may help calm the feeling of lack of control and lack of boundaries and put a limit to anxiety. 5. Change atmosphere. It can be a change of environment or simply targeting something else. When you begin to recognize signs of an attack, try to focus on everything else. Sing a song you love, tell yourself a joke, anything that can stop the negative thought process that leads to panic attacks. Once you have found something that works for you, remember it and stick to this technique next time. 6. Keep a journal of anxiety attacks. Write techniques that help you deal with previous seizures, your doctor's phone numbers, emergency lines, or anyone who has helped you in the past or may help you cope with the attack. Keep such a diary wherever you spend a long time, at home, in your car, and even in your workplace. 7. Do not be alone. Do not be shy about sharing your life with close people. The shame, the loneliness, and the feeling that no one can understand what you are going through may increase anxiety. When you have an attack, contact a relative you know you can trust in situations like this, and ask for help. Talk to them on the phone, ask them to come and stay with you physically, as long as you feel that you are not alone in the battle. 8. Do not be afraid of the attack. Fear increases fear. Fear of an anxiety attack increases anxiety disorders, and therefore, sometimes the attempt to avoid such attacks may increase them. Remember that overall, the attack lasts for a limited time. Get it and let go of fear. If you are suffering from panic attacks often and feel that your life routine is being compromised, it is time to take the coping one step further and resort to therapy that may significantly improve your daily life. Thank you for watching. If you like this video, please share, give us a thumbs up, and subscribe.